So just a quick sort of 5-minute sort of overview of what HDR UK North, so that's north of England. So I'm one of the 7 associate directors for that. And we were set up in May last year. And, you know, there are many fantastic things about the north of England, but one of the things that is not quite so good is our sort of levels of deprivation. And I think this slide shows it, you know, quite sort of comprehensively. We've got a population of approximately 16 million people, some of the worst health outcomes, and 19 of the 20 most deprived local authorities in the north. And so really, you know, we decided that we really needed to do something about that. And not only sort of the deprivation, but also sort of people who are living with frailty as an extra dimension. And some of the sort of the stats here are really quite sort of shocking, you know, additional 61.5 million patient days in hospital, 7-fold increase of stay, an additional 800,000 people with frailty in 50 years time. And we've also seen the effect of the COVID pandemic on sort of frail elderly, and you know, and the outcomes have actually been really quite pronounced. So what did we decide to do about it? So as part of Better Care Partnership, which is one of the thematic streams for HDR UK, we decided to focus on frailty. And we've got a collaboration of 13 NHS and academic contracts. And you can see from both Helen and from Joanne's sort of intro that, you know, the approach that we're taking across the north of England and Northern Ireland is very much sort of one of working together with both academic and health and social care organisations. And in particular, we work very closely with the Northern Health Science Alliance, as Helen explained. So this is the sort of the mugshot gallery, led very ably by Professor Samanir Pirahamid, based at the University of Liverpool, and they are the host organisation. But we've got sort of project leads and cutting theme leads, and I'm the lead for the data governance and architecture. Nobody else was brave enough to volunteer to be my oppo, so you know I go it alone, but actually I've got a fantastic team sort of behind me. And then we decided to be very focused because we'd had a couple of previous sort of attempts, and because it's such a vast sort of area, you know, some of the feedback from HDR UK was that it wasn't focused enough. We thought, right, this is the time to really focus on changing things. So we've got 3 specific projects, and these are the sort of the verticals here. Learning care homes, that's about digitization within care homes, helping care workers to do sort of assessments and also sort of hopefully avoid hospitalization, be able to interact with other parts of the system. And actually, we've had some accelerated funding through COVID because of the impact on care homes and staff. And that has actually sort of taken very strong traction in Newcastle, in Durham, and we're extending that down sort of the East Coast towards sort of South Yorkshire and Sheffield. The second one is around sort of anticholinergic optimization. So these are the types of drugs that are often prescribed to frail elderly, and they can have adverse effects, particularly around sort of delirium and falls. And it's understanding the interactions. And Professor Andy Clegg, who is a geriatrician who works at Bradford Royal Infirmary, has developed the National Frailty Index, and he and colleagues are actually testing that using the Connected Bradford data set, which we have housed in our Yorkshire and Humber Care Record HDRUK, which is a cloud-based platform that acts as a trusted research environment. I'll cover some of that later. And finally, the Better RX is about prescribing of antibiotics, in particular sort of across sort of Manchester and Liverpool, looking at essentially the sort of diversity of sort of prescribing patterns across GP practices, providing a tool that provides immediate feedback and benchmarking so that we can actually sort of improve the outcomes for those involved. In order to bring that all together, we've got 4 cross-cutting themes, very much as with the data can work. Patient, public, practitioner involvement, engagement is absolutely the heart of everything we do. Data architecture, governance and curation, the area that I lead, you know, the critical success factors are associated improvement of data quality, increased membership of HDR UK Alliance, the use of the innovation gateway, improved access to data, and extended use of TREs. We have a health science cross-cutting themes, and very importantly, training capacity building, because this isn't just about the technology. In fact, I would say that it isn't really about the technology. It's about the people and bringing those together and upskilling the workforce in order to be able to use the technology that is available in order to achieve those out. So that's all I wanted to cover on my sort of brief introduction, and I think I'm handing over to Mark.
Thank you very much indeed, Monica. I'll just again put my slides up. So what I'd like to do is I'm going to give 2 presentations in a row. One is looking at HDR UK and particularly HDR Wales, Northern Ireland, and then I'll focus more specifically on DataCan. Just for those of you who maybe are not familiar, Health Data Research UK is the Health and Biomedical Institute for the Digital World. And you can see there are now 8 different sites right across the UK. And you just heard from Monica about one of the newer sites, HDR UK North. We're partnered with Swansea University, so HDR Northern Ireland and Wales together. The Belfast-Swansea link has been incredibly productive over the last number of years. And this is us in sunny Swansea during the site visit before we were funded for HDR Wales, Northern Ireland. And really the reason why it's worked so well together is we've complementary interests, particularly in the areas of public health, precision medicine, and also delivering better care for patients. We also share, we each have an administrative data research centre, which has proved very useful in terms of some of the work we've done together, and also interests in accelerated analytics. The 3 disease areas that we've tended to focus on have been respiratory, eye diseases and cancer, not exclusively for the purpose of this, because I'm obviously going to talk for a very short period of time. I'm just going to focus on a couple of cancer examples. The other thing that's very important is that our cancer registries and cancer data are aligned. And as you'll hear, I'll just mention some of the work we're doing together on that. Something that's been very productive from a Northern Ireland perspective, but also from a Welsh perspective. Obviously, the Secure Anonymised Information Linkage Data Bank, or SAIL, is internationally known and respected, and we've been very fortunate to work very closely with the Welsh team to essentially create a SAIL Northern Ireland, which is now being called the Northern Ireland Trusted Research Environment. And Francis Burns, who I think is on this call, was very much involved working with me to deliver this, and also Simon Thompson from Swansea. The other thing is that we actually get on well together. And partially that's the reason for that is that both myself and Ronan, who leads the HDR Swansea, are both from Dublin. But really we've found that it's been very productive in terms of that sort of Belfast-Swansea link and working together on areas of mutual interest. And one of the things we've tried to do is this slide here is really working together, but bringing together different disciplines and really transcending disciplines, so that we can use the power of data to answer particular challenges, particularly in relation to health and well-being. And the other thing is we've really tried to drive data science at scale using AI approaches and also accelerated analytics. This is Dara McArt and Matthew Alderdice, who've been very much involved in this program, particularly in the accelerated analytics and AI. And we just have a paper out just looking at a potential new evolutionary algorithm approach that we use with AI to identify a potential predictive marker for immunotherapy in cancer. The second example here is, and this is Philip Dunn, who again, another excellent, who did work as a postdoc with me, but now is an independent researcher and is really one of the best postdocs I ever had in my life. He has done a lot of work in relation to data underpinning new insights in colorectal cancer. And you can see some of the wealth of papers that have been published in that regard, where we've been able to really develop a new molecular classification for colorectal cancer. And also we've been able to collaborate widely and at the global level. This is work that we've done with the Global Alliance for Genomics and Health, and particularly their variant interpretation for cancer consortium, which is a driver project of GA4GH. And we developed this variant interpretation for cancer consortium meta-knowledge base, which really brought together all known variants and gene mutations in a single searchable resource for the cancer community. And before this, really, there were hundreds of different siloed efforts. And this data translator, as we call it, has really harmonized the information, but also made it freely available to the community. One of the advantages in Northern Ireland is we have health and social care linked, and also our population of 1.8 to 2 million really allows us to do things potentially at the population level. And this just shows you our new system Encompass, that we're at the moment, we have a lot of silos in relation to different data sources in relation to health and social care. But this program now, when it is completed, we're in the implementation phase at the moment, will really allow us to do a harmonized approach to data analysis right across Northern Ireland. This feeds into our Digital One Health agenda as part of the Belfast Region City Deal, where we not only look at the health of the individual, but health of soil, environments, livestock, etc. A very relevant area, very much gaining traction at the European level and world level. You can see the Stella Kyriakides, the European Commissioner, highlighting the importance of this One Health approach. And we've been really driving this both from a research, but also particularly from an innovation approach in relation to, as Joanne said earlier, we've a lot of SMEs in Northern Ireland, so working quite closely with a lot of the SMEs to really drive innovation in this sector. And this it will be delivered through our Global Innovation Institute, which is both looking at driving the health of our citizens, but also the health of the economy. And so very much that interface between academia, industry, the NHS, and obviously the patient. So that sort of quadruple really driving research and innovation in the sector.